Why do Chinese hospitals shock Americans? Here are the 5 real questions you need to ask before seeing a doctor in China. The most confusing thing for Americans in the Chinese hospital might not be the price tag, it's the door. In the US, a closed exam room door means privacy, but in a Chinese public hospital, an open door often means speed. A lot of my American friends planning a business trip or vacation to China ask me, if I'm heading over there anyway, can I squeeze in a physical exam or see a specialist? The answer is sometimes yes. But before we even talk about booking appointments, prices, and wait times, you need to understand one key thing. Chinese and American hospitals don't just offer different service experiences. Behind the scenes, they run on 2 completely different logics for allocating medical resources. So, the easiest thing to overlook isn't the price, it's the rules. For this video, you just need to lock in on 5 questions. These 5 questions determine whether you actually understand the Chinese medical system, or if you're just getting culture shock from a hospital visit. Let's start with that clinic door that might be wide open. Picture this. You walk into an American clinic, check in at the front desk, and wait a few minutes in the lobby. Next, a nurse takes you into a relatively private room, checks your vitals, makes some small talk, and shuts the door. You sit in this space alone, waiting for the doctors to walk in. For a lot of American middle class, this isn't just a service, it's their baseline expectation for feeling safe in a medical setting. But step into a top-tier Chinese public hospital, and the sensory impact can be completely different. The doctor's door might be wide open. While you're sitting there talking to the doctors, there might be other patients holding their x-rays waiting right next to you. The consultation is usually incredibly fast, and the hospital is probably packed. That's why I always tell my American friends heading to China, if you're seeing a doctor, you might want to bring someone just to guard the door for you. The most confusing part of a Chinese hospital isn't the bill, it's that door. But this doesn't automatically mean the care is unprofessional. It just shows that this system operates around an entire different set of resource trade-offs. In the US, a closed-door consultation is backed by an entire medical culture built around protected health information, patient privacy, and individual rights. While the HIPAA privacy rule doesn't literally mandate doors must be closed, it has deeply shaped the American patient's psychological expectation of a safe medical space. So when an American sees an open clinic door in China for the first time, their gut reaction is usually, is this safe? Is this private? That reaction is completely understandable because they're reading a massive Chinese public hospital using the emotional grammar of the US healthcare system. But large Chinese public hospitals are optimized for high patient volume, rapid triage, centralized testing, and maximizing the use of doctor bandwidth. Let's look at a straightforward data comparison. The average consultation time in the US is about 18.9 minutes, whereas in the largest Chinese hospitals, it's usually only 5 to 8 minutes. If we calculate based on an 8-hour shift, an American doctor sees about 25 patients a day, while a Chinese doctor has to handle anywhere from 60 to nearly 100 patients. This isn't a matter of good or bad. It's just that the US and Chinese medical systems allocate doctor time in completely different ways. What this truly shows is a total divergence in how doctor time is spent. You can't just brush off these high-speed consultations as being sloppy. In many high-volume departments, doctors genuinely develop incredibly fast clinical pattern recognition. But the trade-off is that the patient's time to get explanations, enjoy privacy, and share in decision-making gets heavily compressed. So, before an American walks into a Chinese hospital, they shouldn't just ask, why isn't it like the US here? The much better question is, how do I regain a sense of control in a 5 to 8 minute appointment? The answer comes down to 3 checkpoints. Checkpoint 1, privacy boundaries. If you have sensitive issues, like your mental health status, family history, or past surgeries, write them down in advance. Checkpoint 2, compress your questions. Do not turn your medical condition into a 10-minute story. Have a one-pager ready. Your symptoms, a timeline, medications, past tests, and the top 3 questions you want to ask the doctor. Checkpoint 3, actively save your records. Keep every test report, imaging file, prescription, and medical reports. This decides whether your primary care doctor back home can seamlessly take over. So, the open door isn't the conclusion, it's just the entrance. The real issue isn't whether a Chinese hospital looks like an American one. It's whether you can read this logic, protect your privacy while communicating efficiently, and get the results you actually need. To an American patient, open doors and rushed visits might not scream high-quality healthcare at first glance. Back in these days, you probably determined trust through hospital brands, your insurance network, accreditation systems, and referrals from your family doctor. But the second you land in China, that entire language of trust completely vanishes. Imagine an American middle-class patient pulling up Google and search best hospitals in China. The results aren't nearly as intuitive as they are in the US. There's no familiar Mayo Clinic style brand narrative, no PPO network directory, and no family doctor referral. Instead, what they see are terms like Grade 3A, 三甲, public hospital, expert clinic, and international department. The real struggle is, how do I read the trust signals in the Chinese medical system? Layer 1 is institutional trust. We're talking about grade 3A hospitals, national medical centers, massive public hospitals, or international departments. Now, to an American, grade 3A is a totally alien term, but it basically signifies a higher tier of medical resources, a more complete testing system, and the foundational capability to handle complex cases. However, grade 3A is just the baseline, not the final answer. Just because a hospital is strong overall doesn't mean every single department is a good fit for you. Layer 2 is clinical trust, meaning this specific department at this hospital actually good at solving your specific problem. A lot of true capability is hidden in specialty repetition, department rankings, case volume density, doctor experience, and systemic resources. So, when you're judging a hospital in China, my rule of thumb is this. Look for the grade 3A ratings first, then look for the specific department. The grade 3A solves your safety baseline, while the department solves the true match. That is way more important than simply asking which hospital is the best. Even if you track down a trustworthy hospital, American patients will hit a much harsher reality. Without a Chinese ID card, a local phone number, or a Chinese bank card, can you even get your foot in the door? A lot of Americans think healthcare accessibility is just about whether there are doctors. But in China, a foreign patient's very first hurdle is booking, registering, and paying. In the US, the workflow is incredibly standard. Hand over your insurance card, make the appointment, see the doctor, and get billed later. But in the Chinese hospital, the flow often looks more like this. Book the appointment, physically check in, pay up front, get your tests done, pick up the physical reports, go back to see the doctor again, and then grab your meds. Without someone there to explain it, this feels extremely disorienting. I highly recommend breaking and entering the system down into 4 access points. First, identity. Can this hospital actually register you with a passport? Do you need a Chinese phone number to get SMS verification codes? Can they process you manually at the window? Second, booking entrance. Should you book a standard clinic, an expert clinic, or the international department? That choice dictates your wait time, how much face time you get with the doctor, and whether English services are even an option. Third, payment entrance. Foreign visitors can now link Visa and MasterCard to Alipay and WeChat Pay, and the single transaction limit has been bumped up to $5,000. But here's the critical catch. You cannot interpret able to pay in China as US insurance will automatically work. The US Embassy reminds citizens that most Chinese hospitals will not accept US medical insurance, and Medicare and Medicaid generally don't cover medical expenses outside the US. So, American patients have to flip their expectations. In China, your insurance card is usually not your pass into the hospital. Payment tools, cash deposits, window billing, invoices, and paperwork are the realities you have to figure out first. Fourth, the material entrance. This is the easiest step to overlook. US doctors really need the readable DICOM format disc. And for meds prescribed by Chinese doctors, when you get back to the States, your doctor doesn't truly need to see the Chinese drug name. They need the active ingredients, the dosage, and the formulation. The real question isn't, did I finish seeing the doctor? It's, can my American doctors continue to use what I got? So, you might have already booked the appointment and secured your reports. But a brand new problem immediately pops up. When you bring all these things back to the US, can your doctor really continue using them? If you don't speak Chinese, who's going to translate the entire medical pathway for you? Look, a medical navigator is absolutely not just someone following me around translating Chinese to English. A major Chinese public hospital is a high-traffic, multi-step advancing system. If you're unfamiliar with the sequence, even if every single sentence is translated correctly, you could still walk the wrong process or miss grabbing your materials. That's exactly why I prefer to understand this service as medical navigation. It solves at least 3 things. First, privacy protection and medical history pre-processing, organizing the main symptoms, duration, medications, allergy history, and the top 3 questions you want to ask in advance. Second, in-visit information alignment, confirming what the doctor's biggest concern is, why they're ordering these tests, what are the exact next steps. Third, post-visit information conversion, ensuring you get readable DCOM imaging files, so the reports from your Chinese physical can be quickly reviewed by your American family doctor. Medical navigation isn't a luxury medical concierge service. It acts more like a lightweight layer of risk control. What's truly expensive isn't having someone help you confirm the process. It's missing your DCOM images, misunderstanding the medication ingredients, or bringing materials back to the US that cannot be handed over. The value of a medical navigator is helping you avoid a medical trip that seems complete, but is actually impossible to hand off. Which brings us to the final question. Did you come to China to complete your treatment, or to get a medical certainty to take back to the US? A lot of people think coming to China is complete the entire treatment process. But for many middle class Americans, they might just be coming to find an answer. Is this symptom serious? What do the imaging results mean? They're taking advantage of China's extreme fast scheduling to complete a CT, MRI, endoscopy, or specialist consultation. The value of Chinese healthcare to them isn't replacing the US medical system. More accurately, it is helping them gain medical certainty much faster. Otherwise, you just saw a doctor once in China without ever forming a true medical closed loop. A single medical trip to China must leave you with at least three things: a clear medical judgment, complete raw data, and an English summary and next step plan that an American doctor can understand. For the right patient and the right procedure, Chinese hospitals might more quickly provide exactly what the American middle class truly needs. A safe Chinese medical trip doesn't end when you leave the hospital. It only truly finishes when you return to the US and your doctor can understand what happened over in China.